It's fairly obvious that Trump has the blood of thousands of Americans on his hands for his absolute narcissistic bungling and incompetence from day one of the pandemic. There's a slightly more subtle way that he's oiled that death machine and illness by staffing his administration with people who run the Occupational Safety and Health Administration, which oversees safety and health at the workplace, who don't actually give a damn about workplace safety, and who've let tens of thousands of workers get sick and thousands die from working in places where they contracted the virus. Now, I've seen this hypocrisy replayed time after time. Frontline workers like cops, firefighters, healthcare workers who are held up for propaganda purposes by politicians who bask in the deserved positive images of frontline workers in a crisis. But when it comes to protecting them and paying them decently, politicians go missing in action or worse. Rudy Giuliani was one of the worst of these hypocrites. He embraced the firefighters and the cops during 9/11, but when it came to paying them, he couldn't give a shit. Which brings me to the Oregon Health and Science University, a massive sprawling operation which in 2019 had $3.2 billion in revenues. So it ain't poor, but it's acting like a Jeff Bezos when it comes to paying nurses a fair wage and making sure that nurses are safe when they are doing their jobs during the pandemic. So here to give us the lowdown is Terri Niles, who's an ICU nurse at OHSU and a vice president at Local 52 of the Oregon Nurses Association, which represents in that local 2,900 nurses. Now, it's not a surprise, unfortunately, that in this pandemic, we're learning again, Terri, of another situation where frontline workers, the workers who are held up, rightfully so, as those folks who are really working really hard to save people's lives and also just serve people and make sure life continues. Because I consider among frontline workers those folks who are retail workers, who work in poultry plants, not just those people working in healthcare. But here we are in a situation where you all put yourselves on the front line, and yet your employer doesn't seem to recognize this, and in the midst of this pandemic is in fact making life difficult and unwilling to, number one, give you what you deserve in terms of economic benefits, but also it seems like is sacrificing some of the safety at the workplace itself. And so maybe the way to describe this and start is to give us a sense of what nurses, your members, have been sacrificing in the pandemic and what you're facing on a day-to-day basis.
Okay, so healthcare has changed. And how we deliver healthcare has changed due to this pandemic. Nurses have, starting from the very beginning, there's so much uncertainty, like when they go to work. Protocols that they were using before have changed. Safety protocols around personal protective equipment changed. And so my union has been negotiating for over a year around these protections, and we were able to get some protections put, agreed to through the end of the year. What we're doing now is we're negotiating a contract where we would like these protections actually brought into our contract and provided to nurses as we move forward. Because because COVID's not going away, and nurses and protections like having PPE, knowing how much PPE is out there, having a safety committee that talks about nurses, what nurses are asking for and their needs is something that we would like the administration to honor and to get and permanently put in our contract.
And it is amazing to me, maybe I shouldn't be amazed, because essentially OHSU is almost like a big corporation in terms of its revenues and the money it brings in. It's just astonishing to me that you have to fight over this. And it must be astonishing to you. You're an ICU nurse. You've been right in the ICU. This should be a no-brainer in a moral society where you're putting your lives literally at risk. And as you know, sadly, across the country, nurses, doctors have died fighting this pandemic. It should be a no-brainer.
Exactly. And so that's why it's been so hard for nurses, not only just me as, somebody that works with the nurses union there, but for, just, nurses that are working at the bedside to, kind of understand why this is an issue and why this wouldn't be, like you said, a no-brainer, and why administration wouldn't support, nurse protection and nurse safety. Nurses, I think a CDC report just came out, and nurses are the healthcare worker that is most hospitalized. Um, and most of those nurses are women and Black, and most of those healthcare workers are Black. And so the healthcare inequities and the risks that we're taking is really great. And yeah, it has been kind of astonishing, and something that I never thought that I've never seen in my career before. And I've been doing this for 25 years.
And this is a great point to underscore. You've been in the ICU. You know what it's like to care for patients in the ICU, but the environment there has changed dramatically, right? I mean, you didn't walk into the ICU in a normal time before the pandemic thinking that by walking into the ICU, you were going to lose your life. I get that there were other diseases out there, but this is just a whole different picture for those folks, your colleagues, who now probably every single day that they're walking in, although they're certainly focused on their work, they know in the back of their mind that they're facing a very deadly virus.
Exactly. And if everybody, I know that, all of our community has been, affected by COVID. And if, everybody has to understand that nurses are feeling those same effects that everybody else, and those fears. And then you add those fears of bringing, COVID back to your family, or infecting your family, or infecting yourself. And I think due to the exposure that nurses get, that's why they are there, and they're exposed, and the viral load is large. They're more at risk.
So let's underscore that for a moment, because that's an important point. If I walk into a store, or I'm just passing in the street, and someone happens to cough who's infected, and I'm just passing by, even if maybe a few spores, I inhale them, the viral load is not so heavy where it overcomes my system. It's possible, if I'm a healthy person, that I could fight that off, as opposed to a nurse who's in the ICU and is essentially being bombarded, if I can use that term, it's not a medical term, bombarded by this virus at a very high level.
Exactly. That's my understanding of why nurses are such at risk, and why they are the healthcare workers that are hospitalized the most, is because of their exposure and their continued exposure. If you can imagine 12 hours of working in a COVID ICU, or with COVID patients, clearly your risk is going to be much higher. So nurses are feeling this. Nurses are feeling, it's very stressful. Their job has become very stressful. They worry about their families, they worry about their children, they worry about their loved ones, just like everybody else does, except for they are being asked to put their children and their families and their loved ones at more at risk. So it's been really hard. I have to tell you, I get emails from nurses going, okay, I've just, I can't anymore, So this nursing shortage, I can see that coming if something, doesn't change, and if there's not changes. And so the things that we're asking to put it in our contract, these safety issues and safety precautions, and for nurses, it's really important for hospitals to retain their nurses, and to show them that they're valued for what they're doing. And so
I want to move in a second, and I want to move in a second to the economic questions, but let's tie a bow on this. Give me one or two examples so my audience knows, when you're talking about protections that you want to put in the contract, some specific ones. Is it that I want to walk into work and be guaranteed that I have a clean, fresh mask to wear? I mean, what's the detail to that?
Absolutely. We were able to establish, early on when we first started negotiating, or when the pandemic hit, we were able to put together a task force that that dealt with personal protective equipment, and had communications with administration around that. And we would like that to be codified in our contract, so that continues, because that is going to not, we only negotiated through the end of the year. So nurses would like that. We would like to know, like, what's our, how much PPE do we have? Is it sufficient? Is it something that I can rely on? Putting dirty masks back on, nurses reusing masks and putting dirty masks back on their face is something that I really never want to see happen again. And there was a time when nurses were doing that, and I know there's other places in the country that even had less access to PPE than we did. OHSU being, a premier institution that it is, they had PPE. It was difficult, getting that information from them was important to us, and it was important to the union.
I don't want to pass over that too quickly, because I think we have become so used to hearing those stories in the media that nurses and doctors have had to reuse PPE, put on dirty masks, that it's like the behavior that Trump exhibits every day. It's become normalized. And to me, every time I hear that, I get enraged. And I think we as a society, those of us regular people who aren't in the ICU, have to be outraged every time we hear that, because, again, this isn't just some simple thing. You're asking someone to put their life at risk and not giving them the basic tools just to be safe.
Exactly. And nurses were feeling that early in this pandemic, as, even as the institution that I work for, was unsure of what was coming. There's like, is this going to be another New York? Should we start, and so nurses felt that. And so there were some things that nurses, that we were able, when we put the task force into effect, we were able to kind of make moves towards using personal protective equipment as the manufacturer made it. It's a one-time use, throw it away. And so we were able to negotiate with that with the institution and get that in place. And we want to be able to do that moving forward as well, right? Mm-hmm. So that's why we want to keep that communication and keep those and a way to get information for nurses out to them, and have them have a say on what, on what happens. I mean, they're like you said, they're the ones that are putting their family and themselves at risk every day to come in and save lives.
Now, just in parallel, and this is as important, is the question of economics. And as I said to you when you and I spoke before we started recording over the last day or two, one of the things that drives me crazy is the hypocrisy of institutions and politicians who embrace firefighters and cops and nurses and doctors because it looks good from a PR standpoint. And I'm guessing, having not looked, that OHSU uses smiling nurses in their videos and on their promotional materials, and uses nurses as a way of showing, hey, aren't we a great institution? But when it comes to actually compensating nurses fairly, let's face it, nurses are not going to get rich in this job. It's one of those jobs that you do partly because you love it and you're committed to it. You're not going to get rich, but here your nurses are putting their lives at risk, and yet you've got a very rich institution, as I mentioned, billions of dollars in revenue, and yet they're not willing to pay you just a little bit more to keep up with the cost of living.
Exactly. And OHSU needs to realize that is having an effect on their nurses right now, when they see that we have been in negotiations for almost a year, and that we're stuck on really basic things like safety issues, and then also adequate compensation for what they're doing.
I read what some of the demands were. They're pretty modest. So why don't you tell us in a couple of moments what those specifics are? Because I think my audience will be shocked that this rich institution is standing in the way of what are very, very modest requests.
Right. So our big request right now is we are really advocating for COVID safety protections, including a way to review personal protective equipment. We want that task force that I just talked about with nurse input into safety decisions. And then we want we are asking for paid administrative leave to ensure safety during high risk exposures that nurses could possibly get. We also are looking for to be adequately compensated financially for with just basic basic compensation, like adequate. I mean that.
Tell us what that is, because when I read it, it was pretty modest. We're talking about decent pay, and tell us
right.
tell us what the demand from the union is that's on the table.
Well, we're asking for OHSU has come back with a very originally they offered no even cost of living increases, and basically we're just asking nurses to be compensated for what they're doing. I mean, working in the time of COVID has gotten to is very costly for nurses as well, just like everybody else, childcare, and being able to work. I've had nurses contact me saying, I can't work because, I have 5 kids and I don't have, there's no school, there's no this. So, things that childcare expenses, which could be $3,000 a month, aren't, they're having to come out of their pay to be able to go to work and stuff. So there's, we're just asking to be appropriately compensated.
So what's the percentage? Because I think it's important to understand that what you're asking in terms of percentage pay is very modest.
Yeah, I think if I remember right now, we are at we're asking for 3% the first year, and the first year is now, right? Yep. So we're almost to the end of that year, and 5% for the next 2 years. OHSU has rebounded quite well from their original, where they had to kind of get ready for a surge and stuff. So they've rebounded, and the shortfalls that they have had because of COVID, they've been able to kind of look beyond that. They may not make as much profit as they thought that they were going to make, because they're coming off some very, very profitable years due to the ACA and more people being able to pay for healthcare and stuff. So yes. I think that what we're asking is very fair, and it's not unreasonable, and I'm really disappointed that OHSU has come back with with just minimal compensation for what the nurses are doing to make OHSU. I mean, the nurses are responsible for making OHSU the most profitable hospital in this state, and nurses are responsible for that. We have the highest acuity patients. We take care of the sickest patients and the sickest COVID patients, and so they need to kind of show their appreciation for what nurses are doing for them right now.
Well, let me say this. I looked at their financial statements, and they had revenues of $3.2 billion in 2019, and they have very healthy reserves. So they are acting, as I said in my introduction, just like Jeff Bezos at Amazon. It's nice that they have this sort of veneer of being a hospital and so on. But when it comes to actually compensating people decently, I mean, at least you have a union, unlike people at Amazon. But when it comes to paying people decently, it doesn't do any good to, use your pictures and in videos, the nice pictures of nurses, unless you are willing to pay people what they're worth and what they contribute to making, as you just pointed out, the hospital that it is.
Right. Exactly.
So thank you very much for being on the show, and we are going to follow this, and we will have you back for an update, and keep up the struggle.
Okay. Thank you for having us, and I really appreciate, and the nurses at OHSU really appreciate all the community support that they're getting. Because our safety is community safety, right?
Absolutely. And you deserve it for all the work that you're doing and putting yourselves on the front lines every one of my listeners and certainly people out there in the community should be standing with you both in rallies and in any other support ways that to stand behind you. I mean, you certainly have put your lives on the line, and so the community should be behind you. Again, thanks for being on the show.
Thank you. Thank you for having me.